What is ectropion? Ectropion is the medical name for outward facing eyelids. When you have ectropion, the inside of your eyelid can become irritated. The condition can happen to an upper eyelid or even lower eyelid, but it often happens in lower lid. There are variety of types of ectropion that can affect your eyes. They are broadly divided into groups called congenital, something you have born with, and acquired, that is something that happens over time. The congenital type is the least common type. There are 4 acquired types, that is involutional, which is the most common type and happens because muscles and ligaments get lax or loose as we get older. Then comes paralytic, which is related to the facial nerve injury. Then comes cicatricial, which is related to the scarring of eyelid. Then comes mechanical. What are the risk factors? They include aging, rubbing or pulling your eyelids frequently, wearing contact lenses, having skin conditions that affect your eyelids, or having injuries or surgeries that affect your eyelids. Having facial nerve palsy or paralysis can also lead to development of ectropion. Then what are the symptoms? The eyelids protect your eyes and keep them clean. The signs and symptoms of eyelid ectropion happens because the eye is exposed. Thus, more opportunity for it to become irritated and dry. Signs and symptoms of ectropion may include the following, which includes like dryness, redness of eyes. The different types of ectropion are caused by different things. These types and causes are the following, which includes involutional ectropion. This type is the most common type of ectropion. This can be associated with constant eye rubbing, but it's most often related to aging of eyelids. Then comes paralytic ectropion. This type of ectropion happens along with facial nerve palsy. Like Bell's palsy, this type of palsy comes on quickly. It often causes drooping of one side of your face. A stroke can also cause cranial nerve palsy. Cicatricial ectropion. This is caused by scars and by excessive and repeated sun exposure sometime. You may have this type of ectropion if you are already had blepharoplasty, that is eyelid surgery, or any other type of eye injury like burns or chemical injury. Mechanical ectropion. This type of eyelid ectropion happens when your lower eyelid is pulled away from the eye by some type of heavy weight, like this could be a tumor, a mass or fat or edema. Congenital ectropion. This type of ectropion is the least common type. This is a type of outward turning eyelid that you are born with, like Down syndrome and blepharophimosis syndrome are 2 congenital conditions that may make ectropion more likely. How is it diagnosed? Your ophthalmologist will probably be able to see ectropion of your eyelid. However, they will start by taking a medical history and doing some eye examination. Your lower lid may appear to be lower in position than it should be. The lid may appear to be inside out. Your eye may look redder than it should be where there is exposure. Your lower cornea may be visible and may seem irritated or inflamed, a condition called keratitis. Your ophthalmologist may pull your eyelid even further away and count how long it takes to return to its normal position. This is called snapback test. If ectropion is severe, you might have to blink repeatedly to get it to return to normal position. Your ophthalmologist will almost always begin your treatment by prescribing artificial eye drops and antibiotics or eye ointments to prevent eye infection. However, surgery remains the treatment of choice. Some ectropion surgeries may require a skin graft, such as surgery to correct scarring that causes ectropion. and thanks for watching.